Thank you so much to this board and to you, Chairwoman in particular, for your leadership on this issue. And just listening to all of you talk about it, yeah, it's clear that that you're getting the memo and that you're pushing the memo forward in a really, really strong way. And I do have to thank a few people. I want to recognize Barbara Wilson, and I want to recognize the Mental Health Commission, as indicated by Supervisor Ridley Thomas, who played a huge role in surfacing this issue. We are having a big influence in Sacramento, as well as, in other jurisdictions. The mayor of San Francisco did a featured article about boarding and care closures, and also our new governor. With respect to logistics, you went through many of them. One of the key issues here is to recognize that boarding cares for some are not a temporary place. They're actually a type, in my opinion, of collaborative permanent supportive housing for years, and in some cases decades. The business model for boarding cares is broken, and it has been for a long time, which is why they're closing. The costs of labor, the costs of operations, but also the value of properties in Los Angeles County make the business model broken. And the facilities that we have right now cannot maintain their integrity. They don't have funding for infrastructure. As you've stated, they get about $35 a day. We pay more than that for shelter beds. And if you go to the private pay folks, you can get about $200 a day for a boarding care bed. Every week or so, and the frequency is increasing, I get another email. And as you have stated, this is one of the things that does keep me up at night. Unfortunately, there are a number of them, but this is one of them. And what I learn is that a facility is going to close. It's going to close in a certain area of the county, and that there's a certain number of people, many of whom are conserved, but others who are not, that will actually need to be moved. And Supervisor Solis actually had a motion about the trauma of being moved out of a boarding care. Some of them will go to environments that are new. After they've grown accustomed, then they will not work out. So, getting to the issue of preventing the homeless population from growing and more people falling into homelessness, this is pretty key. Oh, that's my daughter. We've done sorry about that.
Tell her hello.
We've done a fair amount of work, as you all know, getting to the initial motion and then since, including a lot of stakeholder process. And with all principles, including those who need and use the services, their families, this network of amazing people who have been delivering boarding care services and housing for so long. Many of them, on a prayer because they haven't had the resources, but they're so committed to that mission. We have added a lot of patch rate, additional funding to boarding cares for certain people who are particularly vulnerable to try to keep boarding cares open. And what our goal in that is to actually figure out ways to incentivize not only keeping boarding cares around, but growing that network and improving the quality of the environments where people live. There are many things afoot with the state. There was, as mentioned, a request for additional money in the budget, which didn't get through, which is quite disappointing. And I'll have to tell you, it's going to be a lot more than $18 million. We're working with the Steinberg Institute very actively, with CSAC, with the County Behavioral Health Directors Association, many others, including local agencies, to lobby for additional money from the state. We also, as you know, helped create Assembly Bill 1766 by Assemblyman Richard Bloom, which has been modified a bit since its original conception, but is still alive as a 2-year bill, to help the state understand and keep track of what's happening so that it won't be ignored. It cannot be ignored any further. And what I'll tell you about boarding carers is because they're licensed, they don't have access to housing subsidies. So Section 8 funding, No Place Like Home funding can't be used for boarding carers. And I have said for a long time, and I will continue to say that, although I'm a doctor, not a lawmaker, we could look at boarding carers and accept them from the fact that the licensing is an issue when it comes to subsidy, or we could recognize that they provide board and they provide care. And we want to use the housing subsidy for the board, license the care.
That makes sense. Let's do.
The last thing I'll say, and this is the part that keeps me up. What keeps me up is that when we lose these beds, we lose a site in a community. The site in the community is gold. This is what we're doing is we're losing to NIMBY when we lose boarding carers. We talk about inclusive, connected communities. We talk about people belonging in their community. Well, the boarding carers that have been around for a long time are sites, and we need to recognize that they are sacred sites and save them going forward. Thank you very much for giving me some time.
Thank you, Dr. Sherin. Thank you. Again, I'm going to remind the audience to refrain from applause, even though we all felt like applauding you, Dr. Sherin. Madam Executive Officer, do we have members of the public that would like to address us on this item?
Yes, Madam Chair. Would the following individuals please come forward when I call your name? Mark Samuel, R.E. Reisner, Sam Blake, Elena Reineman, Arnold Sachs, Barbara Wilson, Barbara Bowman, Big Washington, Brittany Wiseman, Carolyn Kelly, Clara Cargan, Dr. Mela Desire, Dr. Genevieve Clarell, Eric Previn, Frank Simmons, George Bassetti, Herman, Carrie Morrison, Carrie Smith, Mary Jacobs, Mike Greenspan, Patricia Russell, and Robert Trousler. Please come forward and staff will assist you.
Go ahead. And we're giving you all 1 minute.
Good afternoon. My name is Mark Samuel. Thank you very much for this opportunity today. I own and operate a licensed 100-bed facility called Sepulveda Residential since 2002. Since I've opened the facility, I have admitted each and every one of my residents. I go to the hospitals to meet the residents. I go to the locked facilities. I'm attentive so I can meet all the clients' needs and provide appropriate care and supervision. I speak with all my residents on a daily basis while I'm there. I know the social workers. I'm in constant communication serving our clients and communicating with their loved ones. Year to year, we have heard that help is on the way, that solutions are coming, but we're still waiting. I know I can no longer wait if I don't receive immediate relief from the county by January 1st. My question is to all of you, how do we survive? At $35 a day, and what is going to keep my business afloat? In a business, we're constantly being...
Thank you. If you would like to turn in the rest of your remarks, we will read them, but I think we got the gist of what you're saying.
Thank you.
And we appreciate you as an operator. Next speaker, please.
Good afternoon. My name is Ari Rosner. I'm an operator of Sunland Manor, a 98-bed adult residential facility. We're located in Sunland, California. I'd like to tell a quick story about a typical resident of ours. We're going to call him Robert. He represents 95% of all residents, not just in my facility, but in all residential facilities and boarding cares. He has no family. He cannot work and support himself. He has no money. He has a diagnosis of mental illness. He needs medication 3 times a day, needs psychological care once a week, needs medical doctor once a month, and a psychiatrist once a month. We found him 8 years ago, downtown LA, being homeless. I literally cannot imagine where he would go if we would close. He would not survive. He would end up in the hospital wasting more and more taxpayers' money. In other words, it's a win-win if we stay open, and it's a lose-lose if we should close. 100% of my residents are mentally ill. Around 98% of them are SSI. 75% of my residents used to be homeless. I'm here to ask for whatever you can do.
Thank you.
Thank you.
Appreciate that. Next speaker, please.
Yes, my name is Sam Blake. I run the Blake Home in San Fernando. I'm just going to give you some figures. The first one is 35. We get $35 per client per day. Let's look at some of the facts in the San Fernando Valley. The rent is $3,000 a month. The utilities are over $500. The insurance is almost $3,000 a year. The food is pretty close to $1,000 a month. You guys already know the price of what gas is, the car gas for our vehicles. Running a facility is not only dealing with the financial part of it, but the other agencies that we deal with. For $35 a day, we got to deal with a license that has no compassion for the average board and care. They are our worst enemy, is the license that runs our services. Conservatives is next, but I'm out of time, so I yield back.
Thank you. Next speaker, please.
Good afternoon. My name is Barbara Wilson. I am an advocate, and many of you, or some of you may know that I have been advocating for just this issue to raise awareness and action to prevent the complete loss of licensed boarding care homes in our county. I've been doing this for several years, and I want to thank all of you on the commission and on the board for making this motion. This is really important. I want to just make you aware. You might want to ask yourselves, why aren't there more boarding care owners here today to fight for their own income? I would like to answer that question and speak on behalf of several owners of small facilities who would like to be here today, but because they have no staff to cover for them, they have to stay at their facilities. So they have asked me to speak for them. They want you to recognize, and they thank you for recognizing that they are drowning. They want you to understand that
Thank you. Thank you. Appreciate your testimony. Next speaker, please.
Hello, my name is Caroline Kelly. I was the former chair of the Mental Health Commission, and we issued the report on board and cares. I've continued to be an advocate on the matter because I came to know many of the owners. I came to know residents who stayed at those facilities, and I also, because I was privileged to work for the department, came to know the outcomes of those when facilities closed. Many residents would end up on the streets. I also saw really good quality facilities, and I can tell you they did not survive on the approximately $1,000 that comes through SSI. The nicest facility I saw was at $3,500 a month, and that's really more the kind of rate that it genuinely takes. We need to at least give what we give to shelters now. We need to double the number of owners who are receiving these benefits. It's beyond a crisis waiting to happen. It's heartbreaking.
Thank you. Next speaker, please.
My name is Robert Trossler, and I want to thank the Board of Supervisors for giving me this opportunity to speak on behalf of the chronically mentally ill. I read the report submitted to the supervisors. It was an excellent report, well done, clearly presenting the problems, and I concur 100% with their solutions and their findings. I foresee, without an increase in reimbursement to the residential board and care facilities, a crisis. They will leave a large majority of their residents homeless. I want the supervisors to know that most of these residents have resided in their respective facilities for many years. They've been taken care of, they have been sheltered. These are not street people or streetwise. They cannot survive on the street. They'll end up hospitalized in the emergency room. Police will be needed to intervene, incarcerated, and even deaths. You have before you an opportunity to solve a problem that was not your fault or your...
Thank you. Thank you. Next speaker, please.
Good afternoon. My name is Carrie Morrison. I was a member of the original task force that worked on the report that was issued in January. I do want to give great credit to Barbara Wilson. As Dr. Sherin said, she is a force of nature in advocating for board and cares. And Caroline Kelly was the chair of the Mental Health Commission in 2017 when we started working on this. And we could see the storm clouds on the horizon, but there were no numbers, there was no data, and you can't manage what you don't measure. So I commend the board and I commend the Department of Mental Health under Dr. Sherin for taking the time to undertake the study to find out the really bad news about losing close to 1,000 units in 3 years. Who knows how many more on the horizon. This is something that I appreciate the board is taking on. I would encourage one thing that in the report that was really good. Help the owners develop some kind of voice, an association. That was an excellent suggestion because they are suffering in silence.
Thank you. Next speaker, please.
Good afternoon, I'm Clara Karger with Central City Association. We represent a broad coalition of organizations, from businesses to homeless service providers, committed to increasing the investment and vibrancy of downtown Los Angeles. We're committed to advancing comprehensive solutions to homelessness, and we're supporters of Proposition HHH and Measure H. We stand in strong support of Supervisors Hahn and Kuehl's motion to address the ongoing board and care crisis. We recognize the county for their efforts to help people transition from homelessness, but acknowledge the stark reality that every day, more people fall into homelessness than transition out. Existing board and care facilities provide homes and care for thousands of residents at risk of falling into homelessness and must be safeguarded. We echo the supervisor's call on the state to improve supplemental funding so that board and care homes can continue to play a critical role in our public safety net. We commend the Board of Supervisors for championing solutions that tackle the multifaceted nature of this crisis, and thank Supervisors Hahn and Kuehl for their leadership on this issue.
Thank you. Next speaker, please.
Yes, thank you. Good afternoon, Arnold Sachs. And I'm not a good